Hello everyone, my name is Ghanshyam Patel. I'm a research scholar at Mercy Health Internal Medicine Residency, Rockford. My today's topic is cerebral venous sinus thrombosis, CVST, after vaccination against COVID-19. CDC granted emergency use authorization to 2 mRNA and 1 adenoviral vector vaccine within unprecedented time. When I did analyses on May 16, 2021, there were 272 million COVID-19 vaccine doses were administered in the United States. During those time period, New England Journal of JAMA reported 12 cases of CVST. That influenced me to find out the incidence of CVST after COVID-19 vaccination. So my objective was to find out incidence of CVST, the patient characteristic, specifically their risk factors, and their outcomes. I used Vaccine Adverse Event Reporting System, VAERS, and I accessed the data from January 1st, 2021 to May 7th, 2021. I tried to find mid-DRA dictionary terms CVT, CVST, sinus thrombosis. And here are my results. I find out 85 cases. Out of those, 55 cases were from Janssen, 11 from Moderna, and 19 from BioNTech. The incidence was 3.125 cases per 10 million doses. It is very rare disease. The median age was 46 years. Among those 85 patients, 75% were female. The headache was most common presentation. Vaccination to symptom onset was 9 days. It is referred as thrombosis with thrombocytopenia syndrome. However, only 27 patients out of 85 patients were diagnosed with thrombocytopenia. And 11 patients had heparin-induced thrombocytopenia, positive test for HIT without prior heparin exposure. The outcome was 77 out of 85 patients were hospitalized and 55 patients were not recovered during reporting these events to VAERS. In conclusion, it is very rare disease and COVID-19 vaccination is very important to combat this pandemic. But it needs to be, the physician needs to be vigilant and to be ready and prepare the female patients within their 40s complain of headache within a vaccination, within 10 days of vaccination. This is very serious complaint. So it is very necessary to intervene timely, and if it is suspected, be cautious to use heparin in those cases. Thank you very much for listening my presentation. I would also like to thank Dr. Afenati, Dr. Smith, and research team at Mercy Health for their guidance and support. Thank you for having me here.